My name is Monica Franklin, and I am a master's degree level speech language pathologist. I've been with Tuscaloosa Ear, Nose, and Throat since 2011, and I specialize in voice and swallowing. In this setting, we have patients that have challenges with coughing, chronic coughing, breathing issues, swallowing issues. Sometimes there are growths or irregularities in the tissues of the mucosa of the nose or throat or mouth. Sometimes we capture those for the doctor, and what we use is an endoscopic camera to view the airway and get that information for the doctor so that they can follow up with biopsy or medical treatment, or sometimes just peace of mind that there is nothing threatening going on. We actually see patients from very small, like around 4 to 6 months, if we are looking for laryngomalacia or a breathing deficiency with the babies, all the way through. We have 90-year-old patients, so we are just looking at the efficiency and quality and status of the airway and its function. The speech pathology also deals with all the anatomy from the mouth to the esophagus. And so we are concerned with the structure of the mechanism, the movement, the status of the tissue, and also the ability to swallow, the ability to speak. We look at the ability to control those structures. Sometimes there's apraxia or muscle movements that get interrupted because of different neurological impairments. So we are looking at the range of motion of how well they can move and how far they can move. So there's a lot of intricate parts to speaking and swallowing. That's right. This is a lab station, and we use an endoscope to get the images, the video images of the airway and the tissues around it, and then we play them back for patient education, and the doctor can talk to the patient directly about what's happening. The patient can see exactly what the challenge is and be on the way to treatment and resolution of different things. We record and have an archive of an issue so that we can track it for months or years as the doctor is treating and then following up. For example, if it's a cancer patient, we have to follow those patients for years. So we keep track of all of that information and are able to just review and freeze and present and show progress, and we capture that all here. When there are issues of voice and voice function, we record and get aerodynamic quantifications, just different numbers about the voice, and we store those in the computer as well. And that way we can reevaluate the patient and let them know when they're able to hit targets or make improvements as far as the quality and the stamina and strength of the voice. With Parkinson's, you'll have limited volume, and it impacts a person's ability to communicate with their family or with in society. So sometimes we have to work with that and track that in a numerical way, and so we keep that, structure that information in the computer and kind of give that feedback. And also we've got software so that our younger patients can interact, because there's a lot of video games, a lot of different things to kind of keep it commercially entertaining and educational for our patients. So we've got the latest innovative software and hardware to kind of track improvements and values of the voice. professional voice users, teachers, ministers, lawyers, trainers. They come and have challenges with stamina for speaking or lecturing all day or giving exuberant sermons or singing. We have singers that come, and sometimes there is a structural issue like a vocal nodule situation, or just stamina where we want to work on sustained phonation or the ability to speak for a long period of time without feeling a lot of wear and tear or fatigue with the voice. We work with strategies and different skills so that they can be the best professionally when they're occupational voice users. So that's what we use our software and our training and tips and hacks and all types of things to keep our speakers and singers at the top of their game. Since we are so close to the university, that's been an awesome connection. We had, just speaking of the voice, we had 3 of their lady rowers, and the position is called a coxswain, and they are the leaders of the rowing team that give the stroke direction for the team for the win. So we had some of those young ladies come in because they were having vocal cord issues, actual damage to the cords, so that we had to say, strategize on the best way to give them a winning edge without hampering or harming the speech mechanism. And we were able to do that. It was wonderful and awesome to work with them. And that's been one of the highlights of our association with the Tuscaloosa community.